So we want to welcome you all to our 2020 Out of the Darkness Chicagoland experience, our Teal Bead discussion. As I tried to do so a few moments ago, I am Tandra Rutledge. I serve on the board of directors for the Illinois chapter of American Foundation for Suicide Prevention. I am also the director of business development at River Edge Hospital and a mental health advocate. I would like to welcome this morning our esteemed panelists. We have Phil Martinez, Tracy Pate. Did I say it correctly, Tracy?
Tracy Pate.
Pate. I was trying to be a little fancy there. Tracy Pate.
I appreciate it.
Heather Katz, who will be participating in this discussion this morning and sharing with us from their experiences and perspectives on how we can support someone who is struggling or who has attempted. On behalf of AFSP, I would like to thank again Compass Health for their sponsorship, their partnership, and their collaboration on the Blue and Teal Bead community discussions. Tracy, Heather, and Phil, please briefly introduce yourselves and share, if you like, your connection to this cause.
I'll go ahead and get it started. Hello, everyone. My name is Phil Martinez. I'm a licensed clinical professional counselor by trade, but I've been volunteering with the American Foundation for Suicide Prevention since 2004 when I lost my cousin Mark Mendoza to suicide. I had already been in the profession a few years. I myself have a history of depression and suicidal thoughts, so I come at this from a very personal as well as a professional standpoint. So what you'll hear from me is going to be a combination of those experiences. But as I said, I started volunteering in 2004, did a couple of overnight walks, have done numerous community walks. So this is all new for us. So thank you for being here. Thank you for your support. And I hope you can take something away with this today that will be helpful to you.
Thank you, Phil. Thank you for sharing. And many of us come to this both personally and professionally. Tracy and Heather, feel free to introduce yourselves as well.
Okay, I'll go ahead. My name is Tracy Pate. I'm a licensed clinical social worker. Been in the field for trauma for a really long time, and I'm thrilled to be a part of the trauma program at Compass. And this is my first event, and I'm honored to be a part of it, and I anticipate being a part of it every year. I think as I work with trauma, I see how common it is for trauma survivors to have suicidal thoughts and experiences with losing loved ones to suicide. So it's a cause that is very dear to my heart. And I think it is so important that we destigmatize this and talk about it. So hopefully you'll take something from all of our comments and bring it with you to help.
And I'm Heather Katz. I'm also a licensed clinical social worker, and I work as a family therapist in the trauma program at Compass Health Center. And in that role, I am supporting family members and individuals who are impacted by suicide every day. And so this is a cause and an issue that I think is so incredibly important. And I've also been touched by it personally, losing my childhood friend when I was 17. So I really care about this cause, and I hope that this can be helpful to everybody watching. Thanks so much for having me.
Thank you all. And this is a very important topic, undoubtedly. We want to create a culture that's smart about mental health, and we want to normalize conversations around this topic. So let's start our discussion this morning off with the results of a recent AFSP Harris poll, which indicated that 94% of Americans say that they would do something to help someone close to them who was thinking about suicide. Heather, we'll start with you. What should family members or friends say or do if someone close to them is suicidal?
So it's such an important question. I think, some of the most important things are asking questions and making observations with a non-judgmental stance, saying things like, it sounds to me like you're really struggling. It sounds to me like you're having a really hard time. And ask if they are having thoughts about hurting themselves, and ask more specific questions about that. It's important to listen and take them seriously and express your concern, saying things like, I feel really worried for you. I feel worried for your safety. And then if someone is sharing that they're having thoughts about suicide and they have a plan or the means to do so, then it's very important to encourage them to go to the emergency room or their local hospital for an evaluation. One thing also that can be very helpful is to have the National Suicide Prevention Lifeline and the crisis text line numbers on your phone. I have them on my phone, and it's just a great way to be able to provide a resource. And then talk with them about who else can help keep them safe. Talk about their supports, friends, family, a partner, spouse, their therapist or psychiatrist or spiritual advisor. And then finally, make a plan to follow up. Studies have shown that following up with somebody who's in crisis can help to decrease the possibility of suicide. So maybe making a plan to say, why don't I call you on this evening? Why don't we talk further? Why don't I walk with you over and discuss this with somebody that cares about you, to make sure that they're getting the support they need, including possibly going to the emergency room or making sure that they do go for an evaluation.
Thank you, Heather. I think one of the things that resonates with me about what you just said is the importance of connection. And that connection makes a really big difference if we're going to reach out to those individuals who are struggling and get them the support and help that they need. Phil, I'm going to pivot to you a little bit because I want to delve a little deeper into what families can do. You're in private practice and you work with families who are dealing with these issues on a daily basis. What advice or suggestions would you give to families when you're working with them on helping them to really understand what their loved one might be dealing with at this time and how they are so very important to providing that support for them?
Right. Those are all great things to think about, because it is once you notice or identify that a loved one may be in crisis, or you suspect it even. We always say trust your gut. Better to be safe than sorry. But bringing the family into it can be a great resource. It can also be incredibly awkward to be sharing with someone. I'm worried about Johnny or Mary. They might be thinking about something desperate, or they might be, in a dark place, which are rather vague terms, but sometimes it's awkward to say, I think they may be thinking about killing themselves or taking their own life or suicide. But the more direct you are about that, whether they're mentioning it in passing, in joking, or seriously, you have to take it all serious. You have to take it all serious. And to let the family know also, there is no single event that predictably precedes a suicide attempt. That it's a number of things that we should be looking for. Things such as what they say, what their behavior is like, has it changed, what their mood's like. And trying to identify for the family that, this isn't just a one focused thing. It's a multi-focused, and there are several reasons, because it's very often it's like, oh my gosh, how did I miss that? How did I not know? How did I not pick up on that? It's not, and not to or not to minimize it, but it's more than just, the sadness over losing a pet or a loved one or something like that. Somebody has the blues. These signs are much more significant. And as I said, trust your gut and be as honest and straightforward with the family. I like that Heather mentioned, when you ask someone, are you thinking about hurting yourself? To be even more direct is to say, are you thinking about killing yourself? Because quite honestly, most people who are seriously contemplating suicide, when they think about suicide, they're not thinking about the hurt. They're thinking about the pain that they're going to be relieved from. So thinking about hurting yourself is a much different question. So the more direct we are, the better it is. And it can be awkward. AFSP has a whole campaign out there right now called Seize the Awkward, which you can see on YouTube, that talks about having those awkward discussions with a loved one, with family, with friends. It's difficult to say, where are you? Are you safe? It's awkward. And what our point is that wouldn't you rather seize that awkward than see that go unattended? And the other thing, the last thing I want to add in here is just act like you're the only one who knows. Don't depend on, they must have told someone else and so will call a family meeting, or this person should know. No, act like you're the only one who knows. And like I said, if you feel it in your gut, even if it's light, even if it's, the size of a mustard seed, say something and share it.
Yeah. Thank you, Phil. So many good nuggets in that, right? Trust your gut, seize the awkward. I do always like to tell people, imagine that you're the only person in the world that knows that that person is struggling. So thank you very much for that, Phil. And you hit on a lot of important things and warning signs and things of that nature. So Tracy, I wanna pivot the conversation a little bit to you. We've all been hearing this, right, for the last, 7 months or so, that we're in this unprecedented time, all of the uncertainty of COVID-19 and everything that's happening in our world right now. I'm interested in having you share with us what steps can parents or caregivers take to mitigate the risk of suicide in their loved ones. So here we're talking more about protective factors. So how can we strengthen protective factors during this time of such uncertainty?
It's a really important question. And I think it links back to what you said earlier, is that connection. So what we want to do is validate our loved ones' feelings and emotions. Very often, parents can feel like validating will exacerbate the feeling or make it worse. And studies show it does the opposite. It helps our loved ones feel heard, feel connected, that we're bearing witness to their pain, whatever their sufferings are, that we see them. And getting back to both what Heather, Phil, and you said, Tundra, is this connection that we're not alone. So starting with that and taking whatever our loved ones' families say seriously, acknowledging, if it's a loss, if it's grief through COVID, whatever it is, acknowledging the loss, knowing it's okay to talk about, because very often when we don't know what to do, we avoid. And I think getting back to seizing the awkward approach. It may be awkward. Someone may not be comfortable talking about it. And it's so important that we are talking about it, destigmatizing mental health, letting people know they're not alone, and especially our loved ones who probably feel safest with us. I think offering emotional support, letting them know that they can come to us at any time if they're having a hard time. And also, it's okay if they don't want to talk about it. You can just be physically present. You can do something with them, distract. So letting them know there's an open door. And if there is a loss involved, letting them know that there's no timeline to recover from a loss, that healing isn't linear and there's no right way to do it. And we can't promise when it will feel better. So I think that offering safety, validation, connection, and getting back to seizing the awkward, approaching these topics that very often we don't normally want to approach because we don't know what to do. And that's why I think what we're doing today is so important. It's empowering all of us to start talking about this and connecting with each other so they know they're not alone.
Thank you very much, Tracy. So very important. And as we said, this conversation today is very important. And this is a live streaming event. And we want to hear from those of you who are watching. If you have any questions or comments that you'd like to share with us this morning, please do so. And we will, pose those questions to our panelists and hopefully give you some additional insight. We appreciate you being here with us this morning and want you to feel heard and validated and seen. And that's why this event is so very, very important. So we will move on a little bit further in our discussion today. I know we probably have all heard this before. One of the common myths that I know that I still hear, not as much about suicide, is that talking about suicide will lead to and encourage suicide. Heather, can you explain the role of stigma and fear in why this myth persists and what we can do to debunk this myth and other myths about suicide?
Thank you for asking the question. It is such a common misconception. And I think Phil talked about this beautifully, the idea that talking about suicide, saying the word suicide is important and it's powerful. It's important to say the words that we're feeling. I think that there are so many myths and there is so much stigma about suicide And there's so much myths and stigma about mental health. And it's important for all of us, like doing events like this, to talk about it and to talk about our common humanity and how so many of us are struggling and having thoughts about suicide. Actually, as we all know, studies show is a high rate amongst our population, and amongst people who are struggling with mental health. And so I think it is really important to talk about these myths in particular. And so, as you said, we know that talking about suicide does not raise or increase the risk of suicide. We actually know from research that talking about it reduces the risk. Talking about suicide increases someone's safety because it helps them to feel validated and heard, listened to, and it shows that someone cares about them. And it's really important to talk to them about the supports and the resources available and to help them feel empowered to take steps to keep themselves safe. And I think similarly, talking about suicide, talking about mental health, and doing things, as I said, like this event amongst our family, amongst our friends, as professionals, is really important to help people to understand the role of stigma and how we all can work against it.
Thank you. Thank you very much, Heather. I believe that we have a question. So we're going to see that question here. Sophie writes, how would you handle it if the person you try to talk to gets angry? I've had this happen to me before. Very good question. I am going to open it up to any of our esteemed panelists to answer that question. It is a very good question. Thank you so very much, Sophie.
Jump in on this one a little bit. The anger is usually, and again, I don't want to say this is all very predictable, but it's something where you definitely touched on a spot, whether they're there or not. They wouldn't get so angry if it wasn't such a sensitive topic. But when we think about it, it's, okay, I might lose this person as a friend, or they may disconnect from me, but they're made aware that somebody's noticed and somebody's thinking about them, and somebody took the courage to risk them being that angry and walking away to do that. And that takes a lot of courage, because the response is not always going to be well received. Typically, when somebody's in that state, it's going to be very hard to hear the caring. And what they're going to want to do is run off and hide, which of course is very concerning to the other loved one. But again, you may have planted a seed. You may have opened that door for them. They may realize, okay, maybe I need to pay attention to this if, that made me so angry, once they can get through the anger. But again, one of the other panelists said about following up, even if they kind of go off the grid or whatever, it's somehow, some way, mutual friends, whatever it is, you reach out and you contact them again. And it's, again, like with the seize the awkward, would you rather feel that awkward, or would you rather feel the consequences of not having spoken out?
Yeah, I've often said I'd rather have a mad friend than a dead friend. And so for me, it's important for us to reach out, to trust our gut, to let our loved one, our friend, know that we care, and we're only doing this because we care about them. And also going back to what you said, Heather, all of you said actually, but providing those resources, making sure that they have the National Suicide Hotline, the crisis text number, and any other numbers in your local area for crises is really, really very important. Does anybody else want to weigh in on that question before we move on?
I have something to say, where you may be that person they come back to because they know you took it seriously. So they may need time, and maybe they go to therapy, talk to others, but you've established yourself as someone who takes this seriously and really cares about their safety and willing to risk that for their safety. So I think it sends a powerful message. And I know it can be really hard to be on the receiving end of that, and making sure you get support when someone does lash out, when you're acting out of care and concern.
Yeah. Thank you. Thank you. Very important point, Tracy. And related to what we're talking about, I've also heard people say sometimes that when people express suicidal thoughts, that they're not serious, that they'll never do it. that they are just seeking attention. Now, we know that that is not true. But Tracy, I would like for you to talk about how you would respond to a parent or caregiver who might say that or might think that this is something true.
It's a really important question. And I think sometimes people may want to believe that. And the truth is, we take every comment about thoughts or disclosure about thoughts about killing selves or thoughts of harm seriously. That it might have fallen on deaf ears. In the past, I've worked with a lot of young adults that have disclosed to me that it's a way they kind of test the waters. And they say they're joking or they dismiss it and they want to see what the reaction is. And it's really important that we take this seriously. We let them know these words mean something and we're concerned. And like Heather said, we give resources. And sometimes people will do it in a joking manner. And I have seen that that also is a cry for help. So it is looking for help. It's expressing pain. And we need to take these words seriously.
Thank you. Thank you for that. Thank you. Heather, in the previous discussion, the importance of reaching out, going back to this idea of reaching out for help, if someone we know is struggling was really emphasized, and we talked about it here today, this afternoon. What should family members and caregivers do if they are sworn to secrecy by their loved one who is struggling with suicidal thoughts?
So this is a tough one, and I think it is related to this idea of what if someone's going to be mad at me, right? And I think that it's really important to be absolutely clear and to say, I can't keep this a secret until I know what you're going to share with me and I know what's going to keep you safe. And I think, telling them that their safety is the most important thing to you, and that's your role, is to make sure that you can be a support to them, is a place to start. I think some of the questions that you can ask are, let's talk about who might be of help if they knew. Asking questions in terms of the therapist or psychiatrist or spiritual advisor or friends. If someone is at risk for suicide, you don't need their permission to share that information. And sometimes it's really important that you do, because as Tracy said, they might see that you take this so seriously that as a friend and as someone who really cares about them, that you would take the risk of upsetting them in that moment to keep them safe down the road. And so they then see that you're someone that's going to take them seriously and listen and try to get them the help that they need. Finally, if someone is not at risk for suicide, I think some of the things that you might do as a friend is ask them, are there people that I can help you in telling? Are there people in your life that maybe I can sit with you and we can have this conversation together? Or can I start the conversation as we sit together? And that's something that I've done as a therapist, and something that I've often talked about with adolescents in particular, is trying to figure out how do we have, as Phil said, those awkward conversations and show them that it's something that's okay to talk about and important to talk about for their safety.
Yeah, thank you for that. Those are very, very important reminders. There's so many people who are tuning in today, virtually watching this stream, who really care about and love someone who might be struggling, or they themselves might be struggling. And so it's important for us, especially during this time, to take care of ourselves. Self-care becomes really, really important. And so, Phil, I want you to talk a little bit about what are some ways that caregivers can prioritize their own self-care while caring for their loved one who is struggling. And tell us a little bit about why this is so very important.
Oh, sure. Thanks, Sandra. Yeah, it is vitally important. And the very first thing a caregiver should do, or someone who's helping another that's struggling, is to talk to someone else themselves. Doesn't necessarily have to be a professional, and I'm not discouraging that, but talk to a good friend, a family member, somebody who's close to the situation. no one can carry this burden, nor should they carry this burden on their shoulders, as Heather was referring to with the secrecy issue. But you have to continue. If you notice signs in yourself, if you notice your mood changing, your behavior changing as a result of maybe your worry or your concern, or it may be bringing up some of your own feelings that you had very long. We have to address those things, because talking about this stuff, it's going to bring up things in us as well. And we have to understand that. So that's one of the things that keeps people from stepping out is this is too close to home. But doing those things that are helpful. I always say my example is not the example I expect everyone else to follow. But for me, one of my most grounding things that I look forward to every single day is my 1 hour of yoga that I dedicate that time to myself. You know, and my yogi guides always tell me, leave it on the mat, let everything else go, and just focus on yourself. And at the end, they tell you to thank yourself for being there and for taking that time. Because if you're not there for you, and again, yoga, one example, people will have several different ones. What works for you, the things that you used to do that bring pleasure or peace or serenity to you. To get into those things and to practice them regularly, even on days you don't feel like it, they've helped in the past. You need to go through that, because the most important reason being, if you're not taking care of yourself, you may be missing some of those warning signs.
I think we lost Phil, but I'm going to pretend like I can finish his sentence. But if you're not taking care of yourself, you might not be able to see someone else who might be in distress. I love that Phil shared with us the example of yoga. So I'm going to ask, Phil, you're back. Thank you.
So sorry. I'm connected right into the Ethernet and I'm still dropping. Anyway, what I was going to say there at the end was just that, if you're not caring yourself, you're not going to be in any way, shape, or form able to help care for anyone else. So it's not selfish, it's self-care. And that's a huge difference.
I love that. I was going to say, since Phil is talking about yoga, an hour of yoga, if we all would like to share maybe one thing that we do for self-care, I think that our viewers might be interested in hearing. Again, it's not saying that you have to do these things, but I think it just emphasizes the importance of prioritizing ourselves. So for me, I would probably say one of the things that brings me greatest peace and helps me remain centered is meditation and prayer. That is one of the ways that I try to take care of myself on a daily basis. So,
Tandra, I'm with you. Meditation is so important for me to settle in my body, connect with myself, ground, remember what's important. And it just kind of refuels me as I go out to do the difficult work. So meditation is also my go-to.
Thank you.
So I have so many competing answers in my mind, but I think for me, one of the things is having a group of friends who also care about a lot of these issues right along with me. And, some of them are therapists, many of them are not, but I think our connection and our friendship is one of the things that just helps me, when there's a rough day or when, I'm struggling myself.
Thank you, Heather, Tracy, and Phil, for sharing ways that you care for yourself. It's my understanding that we have a question from one of our viewers, and so let's take that question now. So I will read it. Hey guys, I'm stuck in Melbourne's lockdown and feel extremely lonely. I live alone and have had minimal contact with anyone for the past 4 to 6 months. I am having symptoms that the doctors say panic attack, which I've never had before. The hospital did many tests on me as I constantly have numbness in my left arm and many other symptoms. All tests came back as negative. Could this all be psychological? Because I have finally cried and I still feel a lot of discomfort. That is a big question. but I think it's a question that resonates with a lot of people. So I'm glad that we got this question because we have three very talented therapists here that can speak to this. So I will stop talking now and allow you to answer Jordan's question.
I think without a doubt, and I wish I had coined the phrase unprecedented events, but not to minimize it in any way at all, Jordan, but these are unprecedented times when we are struggling, being in that lockdown, feeling that loneliness and isolation becomes very real. But you are recognizing symptoms, you are doing something about them. And I know it's very limited resources, but the fact that you're trying to do something is very helpful to try and get at what that is. Could it be psychological? Yes. And panic attacks can have, varying effects on people. And I'm glad you're having it checked out medically and having tests done, because that's always the first thing that I advise people who are having any kind of physical symptoms. I don't automatically think, oh, this is just psychosomatic. It's just all in their mind. No. I want them to rule out with their family doctor or any physician, have a regular physical, explain to them what's been going on, and rule out that there is nothing, medically challenging that needs to be addressed first. But there's just such an importance in continuing. I know, I've spoken with people, again, not to minimize your situation at all, but that isolation is something that gets to all of us, even if you're with someone. But it just can be, it's very frightening sometimes. But going out there, reaching out, asking that question, I have hope for you. Continue to seek answers. Continue to reach out wherever you can. I know Zoom is not the same as that face-to-face, but if you have people that you can talk to, even if it's just one person, please keep reaching out. It's so important.
Thank you, Phil.
And I would like to also just validate, I think so many people, the studies are showing such an increase in depression and anxiety and grief response and trauma response because of COVID, and that there is help available virtually if it's somebody if you haven't reached out before, if you don't have a therapist. Some are doing it in person with safety precautions, but many are doing it virtually, and there's many different ways to reach out for help and to initiate that support, because you're not alone. Tapping into what Heather said with Common Humanity, we are seeing such high numbers for mental health distress right now, and it's really important that we're talking about it. And a lot of people are experiencing a traumatic response to the pandemic, this heightened sense of anxiety, hypervigilance, fear of something bad happening, a freeze response, not knowing what to do. And so learning to ground yourself and also reaching out for support are two really important things. And there is so much help available. I know that the question came from out of the country, but there's resources in every country is for a way to find a therapist, and also the support lines can help you. And I'm really glad you asked that question, because you're not alone.
Yes, thank you. Thank you so much, Jordan, for asking that question. Heather, I don't know if there's anything you'd like to add for Jordan and others who may be watching.
I just want to echo what the others have shared, that I so appreciate that you asked the question, Jordan. And I'm sure that there are other people that, as they were listening to your question, were saying, yes, me too, to some extent. I think all of us are feeling, the burden and the stress and the weight of these times. And I think, it's so important right now to be thinking about your own self-care, paying attention to the basics like sleep and eat, and if you can, getting some fresh air. And then reaching out, I think finding some professional support or resources would be a really nice step as well. So thank you so much for asking your question.
And I would remind everyone that even though we are physically distancing for safety reasons, we can still all be socially connected, and that connection makes the difference. We have a comment, I think, that we're going to share now as we wrap up this portion of the program. Well, thank you. Thank you. I do, if I say so for myself, this was very awesome. And I thank you very much to Phil and Tracy and Heather for your time and your really thoughtful responses and comments. And I want to thank each and every one of you who tuned in to listen to this program, to our program today, and specifically to this panel discussion. And we hope that you got something helpful that you can take away and apply to your life today. So thank you, each and every one of you, and enjoy the rest of the 2020 Chicagoland experience. Thank you all.
Thank you.
Thank you.